Hi everyone, I'm Brooke Ryan. I wrote my culminating report on analyzing the potential of a common funding level for community support services. I completed my practicum at the Ontario Community Support Association, or OCSA. OCSA supports not-for-profit member organizations that provide health and wellness services to help a wide range of clients, including seniors and people with disabilities. My role was to support the Policy and Stakeholder Engagement Manager while writing a report about funding for community support services. So a common funding level has many names. However, the main idea is that a consistent and standardized amount of funding is provided for a clearly defined service based on outcomes. So it's important to fund community support services because of the public health implications. So community support services have potential to promote health, decrease disease prevalence, and improve life by reducing isolation, reducing hospital-acquired illnesses, and improving the quality of life for seniors. It also has impacts on the health of caregivers and frontline workers, as well as providing respite and reduces burnout in these populations. So I did quite a bit of both quantitative and qualitative data collection and analysis to come up with 5 recommendations, 3 for funders, 1 for health service providers, and 1 for advocates. I'd be happy to tell you about my methodologies after if you have any questions, but I'm just going to talk about the recommendations that I came up with. So firstly, for funders, they must ensure higher quality reporting standards by clarifying guidelines, increase provider knowledge based on consistent audits, and eliminate unnecessary administrative burdens for frontline workers. The current data and reporting practices cannot provide decision makers with the right information, and it is burdensome for frontline workers. So creating reporting requirements that are patient-centered and using the current technology can help obtain efficiency in this sector. Funders should collaborate with health service providers to determine a funding model for services. Relationships and collaboration was also mentioned by Britt and Charlotte earlier today. So providers are the ones with the experience to know what services are necessary and beneficial for clients. They understand client needs and can ensure that they are considered in the funding model. And including providers throughout the process of creating a funding model also ensures that they support the strategy and follow the guidelines. So there are 2 successful models in Ontario that I looked at, the Southeast LHIN and the Toronto Central LHIN. They both have really good models that include provider input. Funding levels should be built on a base amount and accommodate the diverse provider and client needs by providing a prescribed range of increase as opposed to a fixed price. There are many factors that play a role in how much it costs to provide a service, so having one fixed price across the province is insufficient to meet unique provider needs. Examples of factors include transportation needs or the urban versus rural environment, among many others. The funding model must consider these variables as well as the compensation framework for personal support workers and other frontline workers, as there is currently a lot of turnover in this area and it is difficult to recruit and retain workers. Health service providers must improve client experience and outcome measurement and involve clients and family members throughout the decision-making process regarding their care. Measuring patient-reported outcomes ensures higher quality care by getting information directly from the client. It also increases provider accountability to obtain positive outcomes. Right now, outcomes are measured by number of clients served, and their health is not considered a factor in evaluation. This can make patients and their family members feel like just another number and can undervalue their experiences. And advocates for community support service providers in Ontario need to ensure that government and other decision makers understand the impacts that a common funding model can have both on the service provider and on the client. The notion of a standard price will continue to be more widespread as the current government focuses on reducing the deficit. This is the Ontario government. However, community support services can have a strong return on investment for the government by diverting care from hospitals to the home. So changing the funding models also gives providers the opportunity to work together to provide an integrated care approach for clients. And advocates must be aware of both successful and less successful models of common funding levels in Ontario and across Canada to ensure that providers are supported and that clients receive the best care regardless of the funding model. So I've presented a variety of information for many stakeholders. Some key takeaways are that funding is inconsistent across Ontario and that can have negative impacts on clients and population health. So therefore, these impacts must not only be considered in funding models, but they need to be built around providing high quality care and ensuring positive outcomes. I have a couple extra minutes, so I'm gonna skip thank yous for a second. These are the services that I looked at. So assisted living services, Meals on Wheels, congregate dining, transportation. These are all community support services that are publicly funded in Ontario at the moment. The structure of the Ontario, the local health integration networks is changing, but I looked at an analysis of the comparative reports of the funding for the 14 LHINs, and then I looked at specific service providers. So I did like kind of 2 levels of a funding analysis, and then I did a literature review, and I also completed informal consultations with key stakeholders, and that's how I came to the recommendations. So that's kind of boring, but the qualitative themes were aging at home, barriers to accessing care, and care coordination, and they all exist in conjunction with one another. They don't exist alone, so like their care coordination has a big impact on how people can age at home, and then barriers to accessing care make people go to the emergency department, and then they get admitted to hospital, and then they're subject to hospital-acquired illnesses, and there's just like it's a big cycle. Anyway, now I will say thank you so much to Patrick, who was the greatest supervisor that anyone could ever have, I think, Nigel and Kate, and the fellow students here. Thank you.
Thank you. So, questions? Well, I've got a question for you, and you kind of alluded to it in terms, unless, no, there were no late hands up there, okay. Oh, you go. I come last on the pecking order. Yes.
So, without specifically naming anybody in the government in Ontario, and also acknowledging that kind of the whole point of your message was that things need to be focused on the client and their service providers. Sometimes certain government people can be convinced by economic arguments. So I'm curious if you found, from a financial perspective, if this kind of thing is actually more sustainable financially in the long run, can save money. Like, for example, sometimes addressing homelessness is cheaper to governments and healthcare services and all of that in the long run. So,
yes, absolutely. It costs $54, I think, to provide a full day of community support services or home care versus $726, or don't quote me on these numbers, but for one like hospital admission for one day in the hospital. So there is definitely economic proof that having these services, and also I focus more on community support services and not the home care, but the community support services offer constant moderating and like monitoring so that people, registered nurses and home care workers and personal support workers can see if there's a decline in their regular clientele, and then they can acknowledge that and treat that without this client having to go to the hospital at all. So that's another way that we can avoid spending money.
When you were looking at funding, great presentation by the way.
Thank you.
When you were looking at funding across the province, were there any like themes of specific areas that were similar that had inconsistent funding, like rural areas? Did you pick up on any of that?
Yeah, the rural areas were, they definitely had different costs. So it was interesting because in urban areas, the costs were raised because of the rental space to hold the support service. But in rural areas, there was the cost of transporting clients to the space. What was probably the most interesting was with one of my informal consultations, I asked about why there was such a variation in costs, and this person gave me a list of costs just related to transportation. Like it wasn't even related to all the other things like fee for service or anything. It was all related to transportation, which I thought was really interesting.
Good. Well, you've escaped an incredibly difficult question for me.
Oh, great. You can ask it if you want. I can try to answer it.
We're actually running out of time, and I'm teasing you. So anyway, so we'll go. So thank you very much. That was excellent.